welcome to a new edition or other edition of our new Not So Usual Bio Show. And don't get confused, complaints are not going to make it and much less celebrity. Right, Sarai?
Of course, Leslie, this is an improved edition of any other show. We even have a special guest.
That's right. Maybe Harry Styles will not be with us, but we will have a specialist who will explain more about.
Measles!
That's right, so remove your seats and get ready to enjoy and learn with this new edition of the Bio Show.
Okay, but you're surely wondering, what is a bio show? Because in this show, we are practically going to talk about a disease which is measles. Just like I said before, first we want to give you a little introduction about what is measles, right, Leslie?
That's right, Sarai. Well, as a small overview of what measles is, it is a highly contagious illness caused by a virus that replicates in the nose and throat of an infected child or adult. But that will be explained to us better by your specialist.
That's right. So now let's welcome our three specialists.
Thank you for that welcome and thank you for inviting us.
No, thank you, you guys, for coming.
Well, let's start. Speaking of measles, could you tell us what it is?
Of course. Measles is an infectious disease caused by a virus. It spreads easily from person to person and it causes a blotchy red rash. The rash often starts on the head and moves down to the body.
Whoa, that's quite interesting. What else can you tell us, guys, about this?
Well, we would like to explain this case, and for that we gave ourselves the freedom to bring a person who just suffers from the disease.
Oh, that's quite interesting. I've never seen this, so I think it's time to welcome another person.
Well, as we can see, our patient has the disease because she has the following symptoms. A high fever is usually the first sign of measles, and it typically starts 10 to 12 days after exposure to the virus. The fever usually lasts 4 to 7 days. Other symptoms that occur in the initial stage of the infection include cough, runny nose, and red and watery eyes. Small white spots may also develop inside the cheeks. The rash typically erupts next about 14 days after virus exposure, usually starting on the face and upper body and then spreading to the trunk, hands, and feet. The rash stays for about 6 days and then begins to fade.
Whoa, this disease sounds pretty horrible.
For sure. Well, I would just like to ask our guest who suffered from this if she can confirm everything that the specialist just said.
Yes, I feel quite bad and tired, and I can affirm that everything that the specialists have said it's true. Sorry.
Don't worry. As we have already seen the symptoms now, could you tell us how this disease is diagnosticated?
For sure. Well, a doctor will suspect measles based on the common symptoms, including fever and a rash, and especially if the patient has recently traveled internationally or was exposed to someone with a fever and a rash. Laboratory blood and tissues tests can confirm the diagnosis, or also a urine sample may also show evidence about the virus.
Whoa, this is interesting. Shout out to all the doctors out there. And now you could tell us how the disease is treated.
Yes, there is no specific antiviral treatment for measles. Care for a person with measles should include resting, eating well, and drinking plenty of fluids to prevent dehydration caused by diarrhea. Fever-reducing medications, acetaminophen or ibuprofen may be given for comfort, and antibiotics may be needed to treat ear infections or pneumonia, all of which can be developed as a result of the infection. Children who are diagnosed with measles should receive 2 doses of vitamin A supplements likely administered by their physician spaced 24 hours apart.
I love how we are going deeper into the subject. Could you tell us something more about this, such as the kind of immune response the body goes through?
Yes. So, active immunity occurs when our own immune system is responsible for protecting us from a pathogen. Passive immunity occurs when we are protected from a pathogen by immunity gained from someone else. One of the most unique and most dangerous features of measles pathogenesis is its ability to reset the immune systems of infected patients. During the acute phase of infection, measles induces immune suppression through a process called immune amnesia. The patient emerges with both a strong measles virus-specific immunity and an increased vulnerability to all other pathogens. Many pathogens suppress immune function. The influenza virus damages airway epithelial cells and increases patients' susceptibility to pneumonia-causing bacterial species. However, the ability to destroy immunological memory and replace memory lymphocytes is unique to measles virus. So the immune response is active.
Well, we're learning a lot today, aren't we? So, well, I'm really scared about this illness now. So, can you guys tell us about how to prevent this illness?
Yes, actually, you can prevent this illness by administering the MMR vaccine to children around their first birthday. This is a key to prevention, which is why large immunization campaigns in countries with high cases of measles are so vital. The measles vaccine has been deemed safe and effective by the World Health Organization and the CDC and has been in use for more than 50 years. In the US, the CDC recommends all children receive 2 doses of the MMR vaccine. The first dose should be administered between ages of 12 and 15 months, and the second dose between ages of 4 and 6 years. If you have received the recommended 2 doses of the MMR vaccine during childhood, in accordance with the US vaccination schedule, you can consider yourself protected for life. The CDC says 2 doses of the MMR vaccine are 97% effective against measles.
Thank you for all this information. What else can you tell us now?
Well, we would like to list three critical barriers and how they help eliminate pathogens. While mechanical barriers physically block pathogens from entering the body, the skin is the most important mechanical barrier. In fact, it is the single most important defense the body has. The oral layer of the skin is tough and very difficult for pathogens to penetrate. Mucous membranes provide a mechanical barrier at body openings. When you sneeze or cough, pathogens are removed from the nose and throat. Tears wash pathogens from the eyes, and urine flushes pathogens out of the urinary tract. Chemical barriers destroy pathogens on the other body surface, at body openings, and on inner body linings. Sweat, mucus, tears, and saliva all contain enzymes that kill pathogens. Urine is too acid for many pathogens, and semen contains zinc, which most pathogens cannot tolerate. In addition, stomach acid kills pathogens that enter the GI tract in food or water. Biological barriers are living organisms that help protect the body. Millions of harmless bacteria live on the human skin. Many more live in the GI tract. The harmless bacteria use up food and space so harmful bacteria cannot grow.
Well, guys, everything was extremely interesting, but we're running out of time, and also I think our special guest is looking pretty bad, and we don't want anything to happen to her, and we don't want anything to happen here also. So yeah, I hope you like the program.
Yes, but still, thank you for attending and explaining this disease to us and the public. Thank you all very much, and I hope you like our bio show.
Yes, thank you so much.